Did you press record?
Okay. Listen.
Hi, Matt.
Y'all get your PowerPoints. Okay. Last page.
Miss Bird. I left mine in my locker.
Where's your PowerPoints?
Huh? No. I love mine. I think I'll just sit here and just soak in all
Thank you. All right. So very last section.
Dang, this thing's huge.
Okay.
Muscle
injuries.
Whoa.
Come on, bro. It's like the last page.
All right. Page 182, I think.
Page 182.
Yep, 182. Okay. Real quick, we're going to go through this last little section, and then we'll be done with this chapter and done for the semester. Wait, what did you say?
Done?
After this?
Finished?
I mean, it'll be
yeah.
done at the
Over.
last little bit.
Fantastic.
All right, so muscle injuries. First little section here. Strains is the first one here. Y'all probably all strain muscle at some point or another. There's a strain is typically in a muscle or a tendon versus a sprain, which we talked about in the last chapter, which is usually a ligament or a bone injury.
So if you like pull a muscle, is that straining?
Wait, strain is what?
Strain is in a muscle or a tendon, and a sprain, we talked about last chapter, is in the ligaments. It's more skeletal related. Okay, so there's 3 grades of strains. Grade 1 is like a mild, maybe it's just like tight for a day or two. Okay, that's it. I think we all probably strain our muscles and we do something abnormal. Okay, grade 2 is like a moderate strain. This one usually has pain that's associated with it, has a partial tear with some weakness, so maybe you can't do as much because it actually tore some. Temporary loss of function maybe, or at least a partial loss of function. Okay, grade 3 is a severe strain, so usually there's tearing, some kind of loss of function, internal bleeding even, so you may see some bruising, very tender, and swelling as well. A lot of times the muscle tears quite a bit, you know, it kind of like recoils, pull back up and have a big knot. I've seen somebody before that tore their bicep and it's like in a big knot up here. Grade 3s are any kind of muscle injuries, but they're really common in the hamstrings, anywhere that you can, you know, really overstretch. Hamstring is a common place to see this. Lots of football injuries you would see. Strains. All right, a contusion. Anytime you see the word contusion, think bruise. Okay, so a contusion for a muscle contusion is just a really like a deep bruise. So a lot of big football injury, get knees or helmets to the legs, you know, get muscle contusions that way sometimes. Myositis ossificans, you can see that one written in there. It says this involves the formation of a calcium mass with the muscle. So over time, like 3 to 4 weeks, if it gets repeated injury especially, then it can get this build up, this calcium mass there. And it can, if it gets bad enough and it goes long enough without getting better, it can actually turn into like a bone mass. Bony kind of calcium mass. All right, cramps are a cramp, like a muscle cramp is just a muscle that is having spasms. So it's kind of like a misfiring almost of your muscle, but it's in a really intense contraction, muscle contraction. What are some things that cause cramps?
Running.
Not
Usually
stretching.
running itself is not the issue, but there's, yeah, it could be.
A lack of potassium.
Electrolyte imbalances, definitely. That's probably the biggest reason. Dehydration, electrolyte imbalances, a calcium deficiency, or magnesium or potassium deficiency. Dehydration, those are all things that can cause cramps. So it's more likely that it's less the running and more the dehydration because of the running, if that makes sense. And then delayed onset muscle soreness, or DOMS. That's funny, I don't know why. It says follows participation in a particularly long or strenuous activity, so the soreness doesn't usually begin until 24 to 72 hours afterwards. It says it involves microscopic tears in the muscle tissue, inflammation, pain, swelling, all of those can. So they say that microscopic tears is like how that's one of the ways you can build muscle too. So.
Yes, isn't it just from being sore, like even after a workout and stuff like
The
that?
soreness is from the tears, but yeah. So, all right, tendon injuries, tendonitis and tendinosis. Tendonitis is an inflamed tendon, so itis means inflammation. So it could be from an overuse injury, or you could actually have an acute injury to the tendon itself. Sometimes tendonitis comes along with other injuries, even like ligament injuries and things like that. Most people have tendonitis in their knee. They've already got some other stuff going on. Aging, diabetes, rheumatoid, all those things are things that increase their risk from this. What are some common signs of tendonitis, you think? What are some what are some areas of the body that you would think would be really at risk for tendonitis? Knees.
What about your
shoulders,
shoulder,
elbows, wrist, Achilles tendon.
Mm-hmm.
You hear about football players sometimes getting Achilles injuries. Treatment is just therapy, usually steroids. Why steroids? What do they do? I'm not talking about anabolic steroids. I'm talking about like medicine steroids.
Don't you take them and like get out and use?
Yes, you do. So yeah, definitely. So steroids decrease inflammation. So like for somebody who has asthma, steroids is a pretty common medication that's prescribed for asthma because the tubes in your lungs kind of swell up and they get all this inflammation in them and swell up and make the openings really narrow. So have swelling go away. All right, pain meds is another one. Okay, tendinosis is the other one that listed on here. And it says if untreated, chronic tendonitis can progress to tendinosis, which is the degeneration of a tendon. It's more like an actual disease. Okay, something. So it's not, tendon can't get well. And that's why I can't tell you guys how important it is. If you get injured in athletics or whatever, like take the time to get well before you keep going because I don't know, when re-injuring is a lot of times a lot worse than the initial injury. Now, did I do that when I was in school? No. But do I say that now? Yes. Treatment can be months or years even of like decreasing your use. So, I'm crazy. All right, joint injuries. So rotational injuries of the shoulder. This is like repeated overhead motions, right? So what are some athletes you would expect to get?
volleyball, tennis,
pitching, lots of pitchers.
Oh, yeah.
Mm-hmm. Talked about swimmer's shoulder.
Keep that Tommy John's in your elbow.
Says improper motion mechanics increases the likelihood of these. That's why it's important to learn the correct way to whatever you're working on, tennis or whatever. It's important to learn the good mechanics when you're learning how to do that. Overuse of the elbow. Everybody heard of tennis elbow, probably. Right, heard of that?
Tommy John's?
When would that happen?
Tennis elbow.
We need to learn how
Yeah,
to. We need a dodgeball team.
Oh, wow.
So lateral epicondylitis is tennis elbow, right here, and that's just repeated overuse of the elbow bad mechanics or whatever. It could just be overuse. Pitchers get tennis elbow a lot. They get elbow injuries. I'm talking about, you think about it, baseball pitchers are going to be more likely to get an elbow injury versus like a softball pitcher who'd be more likely to get probably a shoulder injury. And baseball pitchers can get shoulder injuries too, but for sure. Epicondylitis is another overuse injury, so both of those. Says medial epicondylitis, known as little leaguer's elbow, can result from repeated throwing and improper mechanics. So, and golfing, it says.
I'm a golfer.
I went golfing once. It was pretty fun.
All right, shin splints. We were talking about this the other day. Says that it's believed to be caused by. Actually, here, let's read it. It says the term shin splint is often used to describe pain localized to the medial lower leg. Condition is an overuse injury that typically arises from running or dancing, particularly running on hard surfaces or uphill. Cause is believed to be micro damage to the muscle tendons that attach to the tibia or inflammation of the periosteum of the tibia.
And it hurts.
It says the muscles potentially involved include the soleus, tibialis anterior, which is the one that's kind of on the side we've already learned about. So, all right, whiplash. This is typically in the neck. Y'all have heard of whiplash before, right? Especially with Rex. Everybody complains about
My mom
whiplash.
always puts her hand. She's strong enough to stop mine.
Mom's always doing that.
I did that the other day to my purse. It wasn't even there, so I think it's a mom thing.
I do that.
But whiplash, one of the reasons whiplash occurs, so what happens, you think about getting rear-ended, okay, so somebody slams into the back of you and you're not really expecting it, okay, your head moves forward and backward and forward, right? So if your head just moves freely, okay, like a bobblehead, okay, your brain inside of your head sloshes around, right? It can hit the front and the back and the front. It's called a coup contre coup. It's not good because that can cause a brain contusion, which has other issues and swelling and things like that. So that's why you don't shake a baby.
I feel like
Because that's the injury that they get. Babies don't have good neck muscles yet. Okay? Our neck muscles react to that very quickly. And so they kind of like clamp down basically to keep our head from going all over the place. That's what it's trying to do. So whiplash then occurs when you've got that injury when your muscles are just like completely clamped down. So they're easier to injure that way because they're shorter and, they're tensed up.
Yeah.
So that's whiplash. But that is, your neck muscles purposefully do that so that you won't injure your brain. That's why a baby, shaken baby, is an issue because they don't have, their muscles can't do that yet. They don't have enough. You think they've been floating around in mommy's belly for 9 months. They haven't had to lift up their head. They haven't had to move around their head very much to build up muscle. So, all right, last two is muscular dystrophy. This is a group of inherited disorders. So this is something that you're born with. It doesn't mean that you have the symptoms automatically when you were born, but it does mean that it's genetic. So when you get it, okay, sometimes you can get it as children or as adults. It means that it was in your genes to get it. Okay. Says the onset may occur during either childhood or adulthood, and the symptoms can range. Some forms affect only certain muscle groups, and then other types can affect all the muscles, including the heart, diaphragm, and other muscles that are involved in, even involuntary processes. So the more severe types usually begin in childhood, and they might include intellectual disability. It said delayed development of motor skills, which would be what? What are your motor skills? Motor, and move. Yeah, so movement. Some forms also affect the heart, so it can cause heart problems. There's no cure for this. There's nothing that they can do except for just try to treat the symptoms of it. Said frequent falling, drooling, drooping of the eyelids. Those are some other things that can cause you. The goal of treatment is just to control the symptoms. And it says some types of muscular dystrophy lead to a shortened life. Kind of depends on how severe it is. And others, depending on how severe it is. All right, and the last one on here is a hernia. So everybody know what a hernia is?
Yeah.
Usually where a section of the intestines pushes through a muscle wall. So it could be in the abdomen or the groin. But basically those muscles kind of separate enough that some intestines push through. Okay, they'll loop through. And you can usually see it. I've seen some pretty big hernias before. Do it. You can. But if it gets to where you can't push it back through, then that means it's strangulating, which means it's not going to get oxygen, which means you're going to have an obstruction, which is not good. So it can get really bad if it does get strangulated, and if the muscle tightens back up or heals back up, and there's still part of that on the outside. Usually hernias require some kind of surgery.
My sister had to get one on her heart.
Do what?
She had to get surgery on her heart because they said she had a hernia.
There are different types. Hernia itself can mean something else has pushed through. So it could be, like I had a friend whose baby was born and had maybe a diaphragmatic hernia where some of her abdominal organs had pushed up through the diaphragm while in utero. It didn't let her lungs form, or his lung. He was a boy. The baby was a boy. So herniation can mean anything can be pushed out of place. A herniated disc, for example, is one of the fibrocartilage discs in the spine have been moved out of its normal place in line. So this particular type of hernia we're talking about in this chapter is specific to something that's being pushed through a muscle wall. So it can be a result of weakened muscles. Some muscles aren't strong enough. Heavy lifting, straining, increased pressure in the abdomen if there's another type of disease or issue going on. So that's that. But usually they're not real painful. Kind of depends on where they are. But
My friend had one. It was right here or something like that. And she said painful. You can't do athletics or anything when you have it or whatever.
They usually do to repair it. They use a mesh. They open it up. They put this mesh little in there and close it back up.
Fred Blake got one where his
A
pockets.
lot of people get inguinal hernias. That's pretty normal.
Got it from Lincoln Tractor Times.
Yeah.
Yeah.
So anyways, a lot of guys their intestine can herniate down into their scrotum too. That's a pretty common, especially weightlifting and doing things, really heavy lifting, things like that. That's another pretty common hernia.
Stop all the heavy lifting.
But that's it. That's the end of the semesters of learning.
Hey.
Okay.
Bye, Maddie.
Nap time.